Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Todd Greene, who is a physician assistant and a new addition to Family Practice Associates. Welcome.
Thank you very much.
Now, one of your interests is men's health.
Yes.
Why are men's health so difficult to get them to take care of themselves?
Oh my goodness, there are lots of reasons why men typically don't seek out health care right away. A lot of it's stoicism, where we tend to be a little more stoic and kind of keep quiet about things. Some of it may be embarrassment over intimating a health concern. Cost can be a factor, embarrassment over certain things, lack of symptoms. If somebody's not having symptoms, there's no problem to fix. So those are some of the big issues that we see.
But there are some preventive things or some issues that men need to pay attention to.
There are indeed. There are indeed. Men need to know their numbers. We need to know our blood pressure numbers. We need to know our glucose numbers, our A1Cs, if we're diabetic or pre-diabetic, if we have hypertension or pre-hypertension. Hypertension is known as a silent killer because by the time you start to see the effects of it, it's pretty late stage. So we want to see that early on. We want to intervene early and prevent death and prevent further organ damage.
Well, now, you mentioned some numbers. What are some numbers they ought to pay attention to?
Sure. Blood pressure normal is 120 over 80. That's the typical blood pressure normal range. Anything above that, you get into pre-hypertension, and then a little higher, of course, you're into stages of hypertension, which, if it's left untreated, can cause permanent target organ damage.
So a trip to the doctor, a simple thing of getting your blood pressure checked, may save your life or prevent heart disease, which is a big thing in men.
Exactly. Heart disease is the #1 killer of men. Ages 40 to 64, heart disease is #1. Following that, cancer, whether that be the top 3 cancers are colon, lung, and prostate. Men need to know their PSAs. Men need to get their PSAs checked. The A1C, the testosterone. Men, that's a big thing these days. Testosterone is a big topic for men. They want to know why they're feeling so fatigued and tired, why they can't lose weight, why they're losing muscle mass. Have a lot of men coming in asking about testosterone as well.
Okay, now you mentioned a few of those symptoms of testosterone.
Yeah.
Are they symptoms of testosterone? Could it be something else? How do you know if you have low testosterone?
Absolutely, it could be something else. There are a lot of non-specific symptoms that go in with low testosterone symptoms. Just fatigue, brain fog, loss of muscle mass, can't lose the belly fat. Lipids will go up. Exercise tolerance goes down. Those are some of the main reasons men come to see us for testosterone.
So how do you find out if it's low?
Check your T levels. We check free and total testosterone. If you are in the zone for treatment, probably going to get a recheck just to make sure that it is in fact a low number. Your testosterone levels vary throughout the day, let alone throughout the month or the year. So one single reading is not necessarily enough to make that diagnosis. And just because your numbers are in a normal range also doesn't mean that you have adequate testosterone levels. So we typically will do a trial, recheck the levels, and go off the symptoms, and then watch the metrics of the blood pressure, or the glucose, the lipids, to see them come in line over time.
Treatable with a medication?
Absolutely. Absolutely.
Used to be a shot, but not anymore necessarily.
No, not anymore. There's actually a new capsule that can be taken daily for testosterone supplementation, and it's showing very good results. Of course, there are patches. There are lotions that you can rub on the arm that's absorbed in, but yeah, testosterone injections seem to be the most common, far and away.
Okay, so trip to the doctor, you can get all this stuff looked at. You can also talk about, you mentioned belly fat. A lot of men are overweight. That's because they don't exercise, or?
It's usually multifactorial. It's usually a combination of stress, poor diet, lack of exercise. It could very well be something metabolic, whether it's blood pressure, lipids, diabetes, or low androgens, low steroid, low testosterone.
You also can talk to people about screening tests that they should have.
Absolutely, absolutely. Men between the ages of 50 and 69 should get a PSA regularly. Over age 70, they typically don't force PSAs at that age, and usually under 50, unless there's a strong family history. We don't usually test regularly under age 50.
Well, thanks for all the care you give. Appreciate you coming in and talking about it.
Thank you, sir.
And if you're one of those men that haven't been to a doctor, it's time to call your primary care. We'll be right back.